感谢刘院长的讲述。
Thank you, Director Liu. We see the distinctive banner of the medical team of Peking University First Hospital behind him. The First Hospital of Peking University is a hospital with a long history and with rich experience in the treatment of critical patients. Director Liu also pointed out that due to the complex condition of COVID-19 severe patients, the use of comprehensive and multidisciplinary diagnosis and treatment is very important. Coming next, from Shandong Provincial Third Hospital, Director Yu Yongtao. Director Liu is the chief leader of Shandong Province's 8th batch of medical team to assist Hubei. He was leading the medical personnel stationed in Wuhan Mobile Cabin Hospital to treat patients. At present, Director Liu has returned to Shandong under quarantine. We would like to ask Director Liu to share the management and anti-epidemic action of the Mobile Cabin Hospital. Please, the floor is yours.
Hello, everyone, honorable experts and dear audience. I'm Liu Yongtao, the director of Shandong Provincial Third Hospital. Today, I will introduce the management of a makeshift hospital during the epidemic and the anti-epidemic actions. From February 9th to March 17th, 2020, I led Shandong's 8th batch of medical team rushing to Hubei province and worked in Wuhan Hanyang makeshift hospital for more than 30 days. I was appointed as a deputy director of this makeshift hospital and mainly responsible for medical rescue. As one of the 14 makeshift hospitals in Wuhan, Hanyang Makeshift Hospital got ready for patients' treatment at 4 p.m. on February 11. Our medical team and I were the earliest team that entered the hospital, and we've been working there until it closed on March the 8th. There were 960 beds in Hanyang Makeshift Hospital. Shandong medical team was responsible for medical treatment of 480 beds. We have totally treated 599 patients, among whom 291 were transferred and 308 were cured and discharged. From this diagram, you can see that the makeshift hospital opened on February 11th, and we found the number of admitted patients soar on February the 12th. In fact, before they were hospitalized, these patients were at home or the community. There were 14 makeshift hospitals in Wuhan totally. From February 4th to February 17th, in less than half a month, 14 makeshift hospitals were built. The makeshift hospitals got support from 22 national emergency medical rescue teams, 3 national mobile PC laboratories, and more than 30 medical teams arrived in 2 batches, and 15 nursing teams, including a team of radiographers. A total of more than 7,000 medical workers gathered to serve the makeshift hospitals in such a short period of time. By March the 10th, the 14 makeshift hospitals in Wuhan accomplished their historical missions. We set wrap-up operation, meaning that it might be necessary for us to get ready at any time. We were also waiting orders. By then, more than 13,000 beds had been offered actually by the makeshift hospitals in Wuhan. We have received more than 12,000 patients in total, accounting for a quarter of the total number of coronavirus cases in Wuhan. As for the background of building makeshift hospitals, as what I said just now, they were founded in a very urgent situation. Coronavirus broke out in Wuhan, Hubei in January, and the number of cases kept rising. Medical resources, especially the beds of all confirmed cases, were far from enough. As a result, many confirmed patients could not be hospitalized for isolation and treatment in a timely manner, which increased cross-infection in communities and the virus spread widely. Therefore, at 10 a.m. on January 23rd, Wuhan, a metropolis with a population of more than 10 million, announced lockdown. On January 25th, the General Secretary Xi proposed 4 concentrations at a meeting of the Standing Committee of the Political Bureau, namely, concentrating the patients, the experts, the resources, and concentrated treatment. To implement the spirit of the General Secretary's instructions, on February the 3rd, Wuhan decided to sort the patients for corresponding treatments. Also, Wuhan announced to open makeshift hospitals supported by the National Emergency Medical Rescue Teams and medical teams from Wuhan in various provinces and cities across the country to hospitalize mild cases of the novel coronavirus for concentrated treatment. In this way, treatment based on scientific classification was achieved. Effectively control the source of infection, cut off the spread routes, improve the cure rate, and reduce mortality. On February 12th, the General Secretary emphasized again on the meeting of Standing Committee to improve the rate of treatment and cure, reduce the rate of infection and mortality, and must follow the principle of leaving no COVID-19 patients unattended. Before arriving in Wuhan, we had not understood the principle thoroughly, but when we arrived there, we found that there were indeed a huge number of patients, which was just as like Academia Wang Chen said. And when our makeshift hospital opened, Academia Wang Chen came to visit us. The initiation of makeshift hospitals was carried out at the darkest hour of Wuhan. The actual situation was what you just saw at the chart. At that time, it was hard to find even a bed in Wuhan's hospitals. Tens of thousands of patients are trapped in their homes or the communities. Wuhan's medical systems was overwhelmed at that time. If the patients could not get treatment in time, it would be difficult to control the development of the epidemic. Therefore, the central government carried out the principle of leaving no COVID-19 patients unattended as the guidance of anti-epidemic work. The makeshift hospitals were initiated and implemented under such a background. In less than 2 months, 12,000 patients with mild symptoms were treated at the makeshift hospitals, which reversed the passive situation of pandemic prevention. What is a makeshift hospital, actually? It originally refers to the field hospital in wartime. It features high mobility and multifunction, including diverse facilities, such as X-ray machine, surgery units, and sterilization facilities. The makeshift hospital had been used for rescuing the patients during Wenchuan earthquake. However, building so many makeshift hospitals for infectious diseases in such a short time was the first time in human history. Academia Wang Chen said that pneumonia caused by the novel coronavirus had a feature. That is, 80% to 85% of patients are mild cases which can even be self-cured, or just need some standard symptomatic medical care. At the same time, be vigilant of the evolution trend towards severe cases. The most important thing is to isolate these patients so that they will not act as a source of infection leading to widespread of the epidemic. Therefore, we should build asylum hospitals with certain medical conditions. The full name of such kind of hospital, according to Academia Wang Chen, should be makeshift asylum hospitals, shortened as makeshift hospitals, I think. What are the basic functions of a makeshift hospital? First, isolation, namely, to let the admitted patients stay at the isolation wards of the makeshift hospital, to cut off the infection caused by family and social connection. Second is treatment. For the mild cases of coronavirus, we offer the medical care according to the laws and characteristics of the disease. Third is monitoring, which helps medical personnel to discover in time which patients are getting worse. Compared with those patients who stayed at home, patients in makeshift hospitals were taken good care of by the medical personnel who would be able to discover immediately once their symptoms worsen. Among the 599 patients admitted in our hospital, more than 200 was discovered timely when their symptoms changed. They were transferred to designated hospitals for intensive treatment immediately. Makeshift hospitals have three characteristics. First, large capacity. For example, the makeshift hospital at which we worked is actually an exhibition center called Wuhan Guobo. Some of the makeshift hospitals were located at a stadium or a warehouse, which were renovated to meet general medical requirements. Large capacity means a large number of patients could be hospitalized. The first three makeshift hospitals offered a total of 3,400 beds to patients. At that time, when a bed is hard to find in Wuhan, makeshift hospitals really relieved a lot of pressure of admission. A large number of patients were directed to makeshift hospitals from their homes. Community spreading was largely reduced, and patient treatment was enhanced. Second, high efficiency. A makeshift hospital can be renovated in 1 or 2 days. Taking our hospitals as an example, we gathered together on February 9th. We went into hospital on February 10th to investigate. You can see Mayor Zhou of Wuhan in this picture. We discussed together in the hospital. At that time, the renovation just began, while at 4 p.m. on February 11th, the hospital was built into operation. It took just 2 days. It had basic sick beds and was divided into polluted areas, buffer areas, and non-polluted areas. It met the basic requirements of 3 zones and 2 channels to prevent nosocomial infection. It had the fundamental medical facilities and was put into operation in a very short time. Thirdly, low cost. With existing spaces, only beds, partitions, bedside tables, etc. needed to be added. And remote temporary toilets. Our hospital had 50 mobile toilets, and on top of that, installed some basic facilities. The cost was significantly lower than those of ordinary hospitals. And that is how a makeshift hospital operates. Our operation aims to centrally isolate and treat confirmed mild cases of coronavirus from various communities. Controlling the source of infection is the main target to avoid cross-contamination in the community, and to conduct integrated disease education and psychological counseling, and give patients scientific treatment timely to prevent their disease from worsening, reduce the ratio of critical cases and mortality. Because such a makeshift hospital is formed temporarily, it shows one of the advantages of our country. Our makeshift hospitals were under the unified leadership of the local government headquarters. Temporary party committees assumed full responsibility, of which I was one of the members. The secretary was fully responsible for the coordination of party committee construction. The director was fully responsible for the operation and management of the hospital. As the deputy director of this makeshift hospital, I was responsible for the medical work of the medical operation team. We were mainly divided into 4 groups, one with the comprehensive information group, being responsible for coordinating the operation plan, including some material issues. Second was the medical operation group, which was mainly responsible for the designation and implementation of the core institution and procedures related to the medication plan, especially the summary of information. The third was the nosocomial infection control group. This was also a requirement for good protection. We also achieved the 3 zeros. There were deaths of patients, there were infection among medical staffs, and there were return of discharged patients to makeshift hospitals. We were required to achieve the targets, so it was very important to conduct protection, especially for medical personnel. personnel without qualified training was not allowed to enter the makeshift hospitals. The fourth was a logistic support team, including ensuring patients' daily life and the maintenance of social facilities, and also supply of some medicines, disposal of medical waste, etc. Although this hospital was set up temporarily, it was all-encompassing and quite complicated. Coordination meetings was held at least once a day. Each group reported the problem they encountered during the meetings. We implemented group shifts and the total duty system. We focused on communication with each other to find and solve problems in time. Some management regulations were worked out quickly for our makeshift hospital, including case management principles, case admission criteria, treatment measures in hospitals, patient identity verification system, and checking system, discharge standards and procedures, critical referral criteria, handling of disagreements during consultation system, and the treatment and rescue procedures when patient symptoms change. Here I will introduce the standard of patient treatment in makeshift hospital, 6 items in total. The first is for mild cases who featured mild clinical symptoms. Manifestations of pneumonia were not seen in imaging materials, but the nucleic acid test result was positive. Some of them had only general symptoms, such as fever, respiratory symptoms, but were not very serious. If imaging materials showed the manifestation of pneumonia, it meant symptoms and imaging material changed. Secondly, the patients were able to live independently and walk on their own. This is also important. Thirdly, the patients didn't have basic diseases, including serious dysfunction of important organs such as the heart, liver, lung, brain, kidney, and etc. Fourth, no history of mental illness. And fifth, the blood oxygen saturation at the resting state should be no less than 93%, and the breathing rate should be less than 30 times per minute. 6. Some other issues to be specifically explained. We mainly follow the previous 5 rules to determine whether or not to hospitalize the patient. So what plans did we take for diagnosis and treatment in the makeshift hospital? The most important work for us was to monitor the patient's vital signs and oxygen saturation closely, as a change in oxygen saturation may be a very important signal to tell symptom exacerbation. To collect the patient's throat swabs regularly, and please look at the picture below, which is a photo of collecting the patient's throat swabs. As for CT, we started to build a temporary 16-row CT inspection area on the 3rd day after the opening of our hospital. This test did alleviate some of the patient's concerns. Special examinations were carried out by the medical team leader on duty based on some changes of patient's condition. Secondly, general treatments, including supportive care for patients, ensuring sufficient calories, strengthening physiological counseling. All patients were required to wear face masks in the hospitals, which were distributed every day. Thirdly, the oxygen therapy. If the blood oxygen saturation is lower than 95, the patient needs nasal oxygen supply. We got the oxygen from the oxygen tanks. The fourth, drug treatments, including antiviral treatments. Everyone knows that we have not found a specific medicine for the treatment. We mainly use some antiviral medicines such as Abidol and also Termiva. If a case was considered a bacterial infection, we also gave him or her antibiotic treatment. Methylfoxacin, levofloxacin, and erythromycin were used for 5 to 7 days as one treatment course. The fifth was our traditional Chinese medicine treatment. Each of our patients took a dose of traditional Chinese medicine. Traditional Chinese medicine therapy had been proposed since the 5th version of guidelines on the novel coronavirus-infected pneumonia diagnosis and treatment. The 6th, symptomatic treatment. If patients coughed or had low fever, we gave them symptomatic treatment. We also stipulated standards for the transfer of severe cases. If one of the following standards was met, the patient would be transferred. For example, respiratory distress, 30 or more breaths per minute, or resting blood oxygen saturation was less than 93%, etc. Persistent high fever, body temperature exceeding 38.5 degrees for more than 2 days. These were the standards of transferring to designated hospitals. At the same time, we stipulated discharge standards. Body temperature being normal for more than 3 days. In fact, we were stricter, generally more than 7 days. Secondly, significant improvement of respiratory symptoms without coughing. Thirdly, comparing the lung CT results before and after treatment to see if inflammation was absorbed obviously. Based on these standards, the 3-level expert system would determine whether or not the patient should be discharged. The first was group level, then the makeshift hospital level, and finally the joint discussion. A key rule was that negative nucleic acid test results had to be seen twice. The interval between the 2 tests had to be longer than 1 day. The 5th, in the case of no oxygen inhalation, fingertip oxygen saturation should be greater than 95%. What's more important is that the entire course of the disease must exceed 14 days. The patients had to meet all of these criteria, but we agreed to get them discharged. Finally, I also want to talk about some suggestions and reflections for makeshift hospitals. As medical workers from traditional hospitals, we felt hectic in the beginning when we worked at the makeshift hospital. My first suggestion is to unify the directives, strengthen coordination and unity. Taking our makeshift hospital as an example, there were not so many medical teams in our hospital. Compared with Wuhan Keting makeshift hospital, where more than 10 medical teams were working together, our makeshift hospital was supported by the Maternal and Child Health Hospital of Hubei Province, and supported by the Emergency Medical Rescue Team from Fujian and Sichuan Province, and the medical teams from Shandong, Sichuan, and Hebei Province. The designated hospital was the 5th People's Hospital of Wuhan. Our Shandong medical team was temporarily assembled with 303 members from 150 hospitals of 16 cities. How can such a mixed team form as quickly as possible as a joint force? The answer is unified scheduling, close cooperation. You can't do it alone, or the efficiency will be too low. My second suggestion is to enhance informatization construction. Let's look at the picture above. This is the protective clothing we wore in the hospital. The protective goggle will become dim caused by fog arising from long time wearing. It will be quite difficult for the wearer to complete various records and operations. The accuracy of patient information is very important, so the cooperation inside and outside of the isolation area is quite important. Therefore, advanced informatization facilities are required, which will reduce much unnecessary repeated work. The third thinking is about psychological counseling and humanitarian care, which is quite important for the patients, as I learned in the makeshift hospital. Because the patients in the makeshift hospital were easily anxious, the medical staff needed to provide more psychological counseling to them. Our Shandong medical team established the Hanyang Makeshift Hospital Family Group and posted the QR code on our clothes. Patients could directly scan the QR code to enter the group, given that we were wearing the protective clothing in the hospital. And there were too many patients. We didn't have much time to communicate with them, so we used the WeChat group to communicate with the patients. We arranged at least 3 of our teammates on duty every day to offer 24-hour online services. We answered the questions of the patients. We carried out anxiety and depression psychological tests. The counseling team screened patients with severe psychological problems based on the test results. We conducted one-on-one focused psychological intervention. This walking QR code was quite popular among patients. More than 230 patients joined this group, and our teammate conducted psychological counseling for 232 patients. Sent more than 1,000 replies, spent over 10,000 working hours, received more than 350 praises from patients. Our walking QR code reported by many media, including CCTV News, China.com, China.org.cn, and XinhuaNet, etc., and achieved good social effect. We also established a nucleic acid-positive patient group. Some patients felt anxious when they saw the negative results of others. Therefore, we provided medication guidance and psychological counseling, especially to patients with basic diseases and were reported nucleic acid positive. For these patients, we focused on the entire process of management and developed detailed and standardized diagnostic procedures for them, and invited our professional psychologists to provide them with counseling, which promoted effectively the patient's psychological rehabilitation. We received unanimous recognition and praise from patients, so our Shandong medical team achieved not only 3 zeros but 4 zeros. The fourth one was 0 complaint. Finally, I'd like to quote again the words of academician Wang Chen. The construction of the makeshift hospital benefits from professional judgment, decisive decision, and collective strength. Promoted by the decision of the Central Steering Group, all forces inside and outside of Wuhan acted quickly. Makeshift hospitals was completed and opened in a short time, with the decisive decisions of the central government. The collective strength of the medical and health circles and relevant government departments, makeshift hospitals became a major innovation during the fight against coronavirus. As a new model for responding to large-scale public health events, the concept of makeshift hospitals needs further thought and reflection. This is helpful for the construction of social governance system in capacity. For instance, prior to the construction of new convention and exhibition centers, stadiums, and railway stations in the future, space layout, ventilation system, and related facilities interface should be considered during design stage. This can be implemented as a national standard for large public facility construction in the future. A makeshift hospital can be used as a mature and useful experience for future large-scale epidemic prevention and control. Now the novel coronavirus outbreak is a global pandemic. Other countries can learn from our experience to tackle the epidemic. At present, the novel coronavirus is rapidly spreading across the world. Makeshift hospitals are under construction or have already been put into operation in some countries. China has accumulated some experiences in the construction, management, and operation of makeshift hospitals, which can be shared with countries around the world. We provide Chinese solutions to the world. We work together to fight the epidemic. Finally, I would like to say that I do hope the epidemic comes to an early end and wish the people of the world healthy. Thank you.